Welcome, everyone, to the first interview of the new year of 2024, and I hope everyone will have a good year. Today, I will be speaking with Dr. Shanthini Kasturi, who is the first author of an article titled Measuring What Matters, a qualitative study of the relevance and clinical utility of PROMIS surveys in systemic lupus erythematosus. Shanthi, I want to thank you for taking the time to speak to me and to our listeners on behalf of all the authors of your paper and to discuss this important and intriguing observation. So start with the questions, if that's okay.
Thank you so much for having me.
Perfect. So what was the aim of the study briefly, and why did you decide to study this issue?
Yeah, sure. So it's pretty well known that patients with lupus suffer from diminished quality of life, and this really shapes their experience of the condition. And it's also known that this is how they measure health status. So if you ask a patient how they're doing, they're really thinking about their quality of life, their pain, fatigue, those kinds of things. And when you talk to physicians, it's a little bit different. When physicians are thinking about health status in this population, they're often thinking about objective metrics, lab values, physical exam findings. So there's a bit of a discordance between the patient and the physician, and we're really interested in measuring the patient's perspective. So PROMIS surveys are a very at this point, commonly used metric out there for measuring patient-reported outcomes, which can capture some of these domains of quality of life that are important to different populations. So they haven't been studied extensively in lupus patients, but seem like a very promising tool to look at these domains that are important to the patients. So the goal of our study was really to look at the PROMIS computerized adaptive tests and the domains that can be measured through those vehicles, and to see if there's content relevance and sort of face validity to those metrics in patients with lupus. That was the overarching goal. And we also wanted to see if patients might find these measures useful in their day-to-day clinical care.
Good, thank you. And could you please just expand on the methodology used, how many patients were studied, how you selected them?
Yeah, so, the background was we had done a larger study in which we looked at the psychometric performance characteristics of PROMIS computerized adaptive tests, or CATs, in this population. So we had a cohort of 200 plus lupus patients, and we had them do the surveys. And we really just looked at construct validity, test, retest reliability in that study. So we used that cohort to conduct a qualitative study. So we asked patients who had participated and completed that larger study if they were interested in giving us information and sort of their perspective on the surveys and whether or not they were useful to them. So we ended up inviting all of the participants of that study, sort of calling them consecutively to see if they'd be interested in participating in focus groups. And then once we had gauged interest, we sort of looked and purposefully sampled so that we could have a representative and diverse pool of patients to get all the different perspectives. We were interested in having racial and ethnic diversity, and then also making sure that men were represented in the sample, because lupus is a condition that's more prevalent in women. So we ended up having 4 focus groups of women, and we interviewed 4 men. And we kept conducting interviews and focus groups until we reached thematic saturation, meaning that we weren't generating any new ideas through the focus groups. And I think you'd asked how many participants. So yeah. In the focus groups, it was a total of 28 women divided into those 4 focus groups, and then 4 men.
And it struck me that I get why you didn't one-to-one interviews with men and focus groups with women.
Yeah, very good question. Our goal initially was to do focus groups with men too. So we had wanted to segregate based on gender because we wanted people to feel comfortable speaking about issues that might be relevant to their gender identities.
Right.
And so the goal was to try to do a focus group with men. What ended up happening was logistically it became challenging because we didn't have as many men in the cohort, and those who were interested and available, the availabilities didn't line up to get them all together for a focus group. So it really just became a logistical reason. And then the interviews actually had an upside because it did mean that we could get into some of the unique issues that the men were dealing with, that I think was something that we hadn't anticipated at the outset of the study, but was a nice thing to learn about as we went.
Thank you. And when you were, I guess you sort of answered this question about the selection, but when you how representative do you think it was of the total 200 and something people?
Yeah, I think it was pretty representative. You know, when you look at the quality of life metrics in the subsample, they were pretty similar. So the mean PROMIS scores were very similar in the subgroup compared to the larger cohort. As far as age, that was the same average age. And then we had tried to have, you know, a similar ratio of men to women. I think we oversampled men a little bit. Compared to the general cohort. It was a little different in some respects, though. So we did oversample some of the racial minorities to make sure that we would get their perspectives. So I think the larger cohort was about 30% Black or African American, and in the focus groups, it was about 50%. And then the other thing, I don't know that this was intentional, but it ended up working out this way. We had 70% of the participants in the focus groups and interviews who were insured by public insurance. So that's Medicare or Medicaid, compared to about 50% in the larger cohort. So in some ways, this might have been a sample that was a little bit more marginalized than the larger cohort. And I think getting their perspective on these surveys was actually useful because they may be a population that could actually benefit more from them in some ways.
Okay, thank you. And now we'll actually sort of get into the results. And so I know you ranked them into domains. And so what domains did the patients think were the most important, and the reasons that they gave?
Yeah. So we had all the participants during the focus groups give us their top 5 domains. So we gave them a list of everything out there. And then we said, feel free to make up anything that's not in there as well. And just tell us what are the top 5 that are most important to you. And then we tabulated all the results. And the top 5 that came out were fatigue, pain interference, sleep disturbance, and then physical function and cognition. So those were the 5 that across the board were most frequently listed in the top 5. And the reasons, you know, they're all a little bit different, but the common theme was that these are the aspects of life that the patients felt were so deeply impacted by lupus, and at times were not adequately addressed during their medical visits. So it was a piece of the puzzle that wasn't fully being treated. That came across multiple times with fatigue, many times with pain. The patients would say, you know, my lupus is under control, I'm told, but I'm still in pain, I'm still having fatigue, and we're not talking about it. So these are domains that are important to me. This is, you know, my perspective, and I want that to be shared. Similar with cognition, a lot of people with lupus have brain fog and difficulties with memory. And that's, again, not something that's really delved into in the medical visits. So I think that having that represented in the PROMIS surveys was validating to patients, and it sort of gave them a tool to bring attention to this area.
So along the same lines, we're saying they could bring up other themes. Were there some important themes that they felt were missing from the PROMIS survey used?
Yeah, we wanted to ask that very question, so we did. And there were a few things that came up. So one area that hadn't been addressed in PROMIS had to do with body image. So certainly lupus can cause rashes and disfiguring rashes. And so patients wanted questions related to that. And also medication side effects can impact weight, acne, things like that. So those were not addressed in the PROMIS domain. They were also looking for questions related to relationships, so how they navigate relationships, both with family members, but also personal and intimate relationships, and some of the challenges that come with family planning and pregnancy because of their lupus. So those were domains. And then just more broadly speaking, the idea of medication side effects, they kind of wanted a set of questions dedicated to that specifically. So we asked all the patients, what areas are not covered, and then we asked them to rank them sort of in that overall top 5. And interestingly, most people did not rank any of those missing domains in the top 5. So they were relevant and important, but perhaps not as central as some of the things that PROMIS covered.
I guess that's reassuring in some sense.
Yeah, I think PROMIS, what we sort of saw was that PROMIS is getting at the core stuff.
Right.
And then maybe some of these other topics are things that we could potentially develop more domains around, or can use supplemental disease-specific measures. There are instruments out there that do contain these domains.
Good. And so what would you say is the take-home messages from the study?
Yeah. So the most important thing, I think the first thing, is that we found that patients really felt that the survey spoke to them. There's always been concern in the research community, that PROMIS metrics are generic. They weren't developed with lupus patients in mind. How well are they capturing their experience? And by and large, I think the patients really felt that the questions addressed their experience. So that was a big thing and important because PROMIS is now being used more widely across health systems in different clinics. So you'll see it used in surgical clinics and medical clinics. It's used for quality metrics. And so we can sort of extrapolate from that data, whatever the context, wherever it's being used, that it is capturing something of importance to this population. So that's one thing. We also learned which domains are important to this population. And I think that really confirms some of the work that's already been done there. We know that fatigue is huge in this population and pain is a big problem. And so this is further evidence of that. And then the other big finding is that patients want to use these metrics as part of their care. And I think historically, patient-reported outcome measures have been used for research. They're certainly part of all the drug trials. They're being used in quality metrics now more, but they're not used routinely in clinical encounters. So when you go to see doctors, sometimes you'll do a hack, sometimes you might do a rapid 3, but it's not always the case. And if you're doing them, you're not necessarily talking about the results with your doctor. And from our focus groups, what we learned is that patients really want to be doing these surveys and they want their doctors to talk about them. And they gave a lot of reasons for that. The first being that they felt like these surveys are capturing their perspective. So it's setting an agenda that means something to them. So that was one thing. And that in doing so, that actually enhanced communication between the provider and the patient. So they felt like it was something to aid that. They also felt like this was a way to monitor their course and their disease. So they could track their pain as their medications changed. They could track their energy. They could see what new symptoms were coming up, and that could inform their treatment down the road. And then the final thing that they raised in, our thematic analysis was that the very just fact of doing the surveys in some ways was a validating and empowering act for them, because they felt like they were being asked about things that were important and that their opinion mattered, their perspective mattered. And that can be activating for a patient and can help them to be more engaged in their care. So I think for all those reasons, they really want the surveys to be part of their clinical experience.
That's very interesting. It would be very interesting if they get fatigue of the survey. So
yeah, some patients, they did say, they want to be able to pick which domains they want to do. They don't want to do all of them. But the nice thing about the cats is they're a little bit more precise, and they have decreased responder burden than some of the other instruments, usually only doing 4 questions for a domain. So that was something they liked.
And quickly, approximately how long does it take to do this particular cat?
So we did, I have to remember how many different domains. I think we did 12 different domains, something like that. And it took about 5 or 6 minutes, I want to say something. It was fairly quick. I'm not exactly
No,
sure.
no, that's fine, but under 10 minutes, we'll say.
Yeah, I think that's accurate.
So it's not too big a burden, really.
No, it's not big burden. I think that's the big advantage of cats, because a short form you'll have 10 to 30 questions for a single domain, and that can take a while.
Yeah. And is there anything you'd like to add for the listeners that maybe we missed that I didn't ask about?
Yeah, the only other thing I meant to say when you asked about what domains were important, I mentioned that we learned some new things about the experience of men with lupus. And something that came up when we asked them about what domains are important to you, many of them, I think 3 out of the 4 of them, ranked anxiety in their top 5. And this was more commonly ranked in the men than it was in the women.
Interesting.
And we didn't anticipate that. And so we asked them about that in the interviews. And they really emphasized that they wanted to talk more about their social and emotional health, and that this was not something that was always addressed in their visits. And so it just sort of spoke to us as maybe an area of unmet need. Men with lupus are in the minority in this particular case. And so I think more work is needed to investigate that, but it was a sort of unexpected finding.
That's very interesting. You wonder what kind of bias we have as physicians towards men and women. This whole stoic man not saying anything, and women are more emotional. It's a fascinating finding.
Yeah, it's definitely caused me to think twice, when I'm seeing my patients, how I'm approaching them. So
that's very interesting. Anyway, I want to thank you, Dr. Kasturi, for taking the time to review the findings and implications of this very interesting paper. And to the viewers and listeners, please read the complete paper titled Measuring What Matters, a qualitative study of the relevance and clinical utility of PROMIS surveys in systemic lupus erythematosus. There's also an accompanying editorial by Dr. Zahi Tuma, Ionas Perotis, and Vibeke Strand of the University of Toronto, Canada, Karolinska Institute, Stockholm, Sweden, and Stanford University Medical Center, Stanford, California, respectively, and their editorials titled More Evidence on the Validity of Measurement Properties of PROMIS Cat in SLE. Both of these are now available on the journal's website at jroom.org and will appear in the January print edition of the journal. I want to thank everybody for joining us and hope you'll join us next month when I speak to the author of another article of particular interest, which I selected from our February 2024 edition of the Journal of Rheumatology. I'd love to hear your comments on, I used to call it Twitter, formerly known as Twitter, now X, at jroom, or by email at manuscripts@jroom.com, and to all a happy and healthy 2024. Thank you.
Thank you so much.
Thanks.